Amazing story. Yeah, I'm Jaime Gomez. Yeah, like Ernesto was saying, if somebody would have told me a story like that, I would not have believed it. The problem is that I was actually involved, so I saw some very strange things happen to me also, and I didn't know quite what to do. But let me give you a little background, just what I do and what my training. That way you get an idea how unlikely something like this is to happen. I'm what you call an interventional cardiologist. I'm a hybrid between a cardiologist and a cardiovascular surgeon. It's a relatively new field, but we've been around for about 15 years or so. I trained in some of the top places in the country, particularly in Houston. I spent about 12 years in academia at the University of Texas in Houston, where I trained with some of the best surgeons in the world and some of the best interventional cardiologists in the world. And I remember thinking the last place on earth that I would go to was the Rio Grande Valley. I mean, that was honestly what I thought, and my mentors agreed with me. They said, you're going to stay here at the university, you're going to teach, you're going to work here. But God had different plans. Well, for one, I married a woman from Brownsville, and we started having children, and she wanted to go home. And so we thought about it, and I said, okay, we're going to go back home. And I remember, when we were going back home, my mentors telling me specifically, said, listen, you're going to go to a very dangerous part of the country. It's highly litigious. You're going to be on your own because not a lot of people have training. You're not going to have backup. So some of my older mentors told me, first of all, we think it's a mistake that you're going to go there. But if you're going to do it anyway, then go with caution. And you're extremely well trained. You can do it, but don't do anything risky for about a year. Don't do anything risky. Just do simple stuff, very easy stuff for you. And after you've been there for a while, then you can start doing things that are more challenging, surgically or otherwise. So then I went and joined a big group because I thought, well, they're going to be able to help me, they're going to be able to back me up, and they're older guys in the group that have experience, and they'll be able to help me so I can kind of hedge my bets on difficult cases. So the first year, I go down there. All of the senior partners go on vacation either to Europe or to California. So I'm there by myself. I think I was just out of fellowship maybe about 6 months or so when this happened to Mr. Gamez. And I remember just being completely on my own and thinking, wow, I hope nothing serious comes in because I don't know, I'm not exactly, I mean, I guess I have to try to do it, or I can transfer people to Houston, or just, and like he said, I was on a salary, so whether I worked or I didn't work, I got paid. And one of the things we learned in training is don't look for trouble. So don't go to the emergency room. Just avoid the emergency room at all costs because it's all trouble. It's the most dangerous place. The patients are at their worst. It's the sickest patients. It's the most desperate situations. It's a very, very dangerous place for you to be at. So, and I learned, and that was a different lesson that I had just learned from training, from years of training. You don't go to the emergency room unless you're really asked for specifically and you're forced to go. You wait for them to come to you. That's the way that the system works. So I remember I remember myself on that day. The only interventional cardiologist in town. Patients all over the place, in the office, in the hospital, getting calls. I'm just swamped, and just driving around and thinking, I have to go to this one particular emergency room, but I have no patients there. I remember just having this urge to go to the emergency room. But not in any emergency, just go to this particular emergency room. I remember walking into the emergency room, and there's an area where the doctors do their paperwork. And And that's really the worst place to be at, because as soon as the emergency room doctor sees you, he gives you 2 or 3 cases, he asks you for your opinion, he involves you in all these cases that are already tricky, and you already have a bunch of work to do, and it's really dumb to do that. So I show up in the emergency room, and then not only that, I go and I stand next to the emergency room physician, the head emergency room physician, and I stand right. He was sitting in the chair right here, or actually to my left, this position, sitting to my left, and he's looking at, and I see him. He's struggling. He's looking at a chart, and he's really struggling. And I'm thinking, I'm standing there. Young guy, just out of fellowship, no business there. And I remember thinking, stupid, you need to get out of here. and thinking, oh yeah, okay, yeah, this is really dumb, why am I here? And as soon as I have that thought that I'm going to leave, and I'm going to run out of there before anybody sees me, I look down at this emergency room doctor, and he's struggling. He's on the phone with another doctor, and they're struggling, and they're saying, this man just had this, he's having seizures. It's probably, it's probably an aneurysm rupture in the brain, or who knows, but it's with the brain. And I remember looking at it just briefly, just from my peripheral vision, looking at the chart, and they gave it the diagnosis and saying, no, this man is having a massive heart attack. The reason he's having seizures is because he has no blood in his brain. And that happens, with our heart attack patients sometimes. And I remember thinking, okay, you're not even asked to be part of this. It's probably a very bad case. I'm sure this man has a cardiologist somewhere else that they're going to call him. And I just remember thinking, oh, that's why I'm here. Okay. All right, so I'm here. Okay, God, I'm here. So I remember tapping the emergency room doctor on the shoulder saying, you don't know me, but this patient here that you think is having a seizure, yeah, he's having seizures, but it's not because there's anything wrong with his brain. It's just he has no blood to his brain. He's having a massive heart attack. And just like Ernesto said, he looked at me and he's like, who are you? and well, I said, well, I'm so-and-so interventional cardiology, and really he needs to go to the operating room. And I remember the emergency doctor looking at me like, what? No, this guy is having seizures. He's in a CAT scanner. We're going to finish working him up. And I mean, he just thought this young guy's coming here and tell me what to do. And I remember just very patiently, because I figured I was there for a reason. I said, I guess I'm already here. I'm not gonna pitch a fit. But I told him this very calmly. I said, if you want him to be alive, you're going to put him in the operating room. And I told him exactly what to do. We're going to do this and this and this and this. And I'm going to go get the operating room ready. And I remember him looking at me like, I guess you're serious. Yes, I'm very serious. I'm going to take him over. So I go and I do the orders. But I didn't police him. I didn't go over to make sure, because I was not involved. And I figured if I start getting in his business, I could get into serious trouble, because I was eventually probably going to be consulted, but it's not my house. So it's his emergency room. I can't go in there and take over people's cases randomly. You can get in big trouble doing that. So I just told him what to do, and I'm going to go wait for the patient. I have no idea who